If you're taking something for allergies, insomnia, anxiety, depression, or even your bladder, well then you have to be careful, as some of these drugs may be quietly increasing your risk of dementia. In fact, taking one of these very common pills daily for 12 months may raise your risk of dementia by 50%. And there's strong evidence from multiple large studies that show that these particular medications are linked to brain shrinkage and memory loss. And these are not some exotic or experimental medications. They're everyday medications that are probably sitting in your medicine cabinet right now. So in this video, I want to walk you through what these drugs are and how they're silently harming your brain. And I'm going to go over safer alternatives they can use instead. And by the way, if you have family members that are taking any of these medications, share this video with them, as there's so many people that are quietly damaging their brains and accelerating the onset of dementia without even knowing about it. So these drugs we have to be careful with are in a class of medications called anticholinergics, which is just a fancy word that means they block a brain chemical called acetylcholine. And acetylcholine is a vital neurotransmitter that acts like your brain's spark plug. So acetylcholine basically helps neurons talk to each other. And you need acetylcholine to remember things, to pay attention, and to even move your muscles. So when you take these drugs for extended periods of time, it's like throwing a wrench into your brain's communication system. The brain signal gets weaker and weaker over time, and this is what leads to memory loss and dementia. Now here's the important part. Anticholinergic drugs are in a lot of common medications. So here are just a few examples. Your allergy medications like Benadryl are anticholinergics. It's also in many over-the-counter sleep aids like Tylenol PM or Unisom. And some of the anxiety medications fall in that class as well. So medications like hydroxyzine, which another name for that is Vistaril. And a lot of bladder control medications like Ditropan or Detrol fall in the class as well. Also, many IBS medications like Bental and even your motion sickness patches like scopolamine patch are also in the class of anticholinergics. And some of these are prescription medications and many of these are over-the-counter medications. But they all have the same brain-blocking effect. And there are multiple studies that show this. First, there was a systematic review and meta-analysis that looked at over 1.5 million people that showed that anticholinergic drug use is an independent risk factor for all-cause dementia and Alzheimer's disease. And it also showed that heavier anticholinergic drug exposure is associated with a higher risk of dementia. And there was another concerning study, which was a meta-analysis of 21 studies that showed that anticholinergic use for more than 3 months increased the risk of dementia on average by an estimated 46% versus non-use. 46% increased risk just from 3 months of being on these medications. And there are many more similar studies that show this. And there's one last study I want to mention is this one from JAMA Neurology that looked at brain imaging and brain metabolism that showed that the use of anticholinergic medications was associated with increased brain atrophy and brain dysfunction. So this isn't just about feeling groggy. These drugs change the shape and size of your brain, and they affect your brain's metabolism. And once you understand what's really happening in your brain, you'll see why these medications can be so harmful if you take them long term. So the key thing to understand is in your brain, acetylcholine binds to receptors on neurons, and specifically it binds to the muscarinic receptors. And this is what facilitates communication between brain cells. And these muscarinic receptors play a crucial role in the parasympathetic nervous system, and you can find them all over your body. Not just your brain, but in your heart, your lungs, and your digestive system. So that's why these drugs are used to reduce your symptoms like nausea, gut spasms, or an overactive bladder. But in the brain, these drugs block communication in areas like the hippocampus and the cerebral cortex, which are essential for memory and cognition. So this is why these drugs can become a big problem. In the short term, they can cause brain fog, confusion, and slower reaction times. But with long-term use, this will eventually cause permanent damage and brain shrinkage. And this is especially pronounced in the elderly because as we age, our natural levels of acetylcholine already tend to diminish. So if you're taking a medication that further reduces acetylcholine activity, you're essentially just speeding up that decline. So what ends up happening is you're basically cutting off one of the brain's main lines of communication. And the longer that goes on, the more damage it causes. So, having said that, how do you deal with this? Now, I'm not saying these drugs should never be used. Taking one Benadryl for a night or 2 nights when you can't fall asleep is not ideal, but probably fine. Also, sometimes we have to use Benadryl for severe allergic reactions, and sometimes we have to take these drugs for urinary incontinence or irritable bowel syndrome. But what we want to avoid is taking these medications every day for months or years, and this is especially important for the people that could be at a higher risk than others. So this would be people that are over 60 and people that already have memory issues, or it could be people that take more than one of these anticholinergic drugs at the same time. And that is actually very common, and I see it all the time in my practice. A person might be taking hydroxyzine or Vistaril for anxiety, and then they take Benadryl or Unisom for sleep, and they may also be taking Ditropan for bladder control. Together, they're actually shutting down major parts of the brain and the central nervous system. So here's what you do. 1. Go through your medicine cabinet and look at both prescription and over-the-counter pills. And search online or ask your doctor or your pharmacist if any of them are anticholinergic. Next, do not stop any of your medications or make any changes to your regimen unless you discuss this first with your doctor and ask your doctor to see if you can be switched to any safer alternatives, especially if it's something that you need to be on long term. So for example, for sleep, a non-anticholinergic alternative could be something like melatonin, ashwagandha, chamomile, or magnesium. If you're using prescription medication, something like trazodone has minimal to no anticholinergic effects, and it's very helpful for sleep. Next, if you're suffering from allergies, well then you want to lean into using second-generation antihistamines. So, drugs like Zyrtec, Claritin, or Allegra, as opposed to drugs like Benadryl because they have minimal penetration into the central nervous system and the brain. Now, these second-generation antihistamines are still anticholinergic, but they're less likely to cause anticholinergic effects. Next, if you're taking bladder control medications like oxybutynin, nitrofurantoin, Detrol, or Vesicare, well then you need to ask your doctor about a non-anticholinergic option like mirabegron. And if you suffer from IBS and you prescribe a drug like Bentyl, well, then I would talk to your doctor about alternatives like peppermint oil. And there's other prescription medications that your doctor may choose. And a lot of it depends on whether your IBS is constipation predominant or diarrhea predominant. And if you've been on these drugs for a long time, you do not need to panic. But you can start optimizing your brain health now by getting regular sleep and getting regular exercise. And you need to focus on reversing other risk factors that cause cognitive decline and dementia. So reversing things like insulin resistance, high blood pressure, or heart disease. All right, I hope this was helpful. Stay healthy, and I'll see you in the next.